Hi there, welcome to part 2. Now let's recall this red structure. This red structure is called the Mesonephros, with its tubules draining to a duct called the mesonephric duct, here in orange. At the inferior part of this duct, a ureteric bud would develop, drawn here in pink. This develops and later creates the adult ureter. Later, it also will develop into the renal pelvis, calyces, and the collecting duct or the collecting system. Now, let's see where this ureter would go. So, the ureter would conduct urine to the urinary bladder, right? So, let's focus here on this cavity here, the one drawn or illustrated in yellow. This is where the urine would empty. So, in the beginning, there is a common channel between the anterior portion here where the urine would pass and the posterior portion here where the feces will pass. This is called the cloaca, the common channel between the anteriorly located urogenital sinus and the posteriorly located anal canal. Later, a septum will develop and divide the two. Notice here that the ureter, here in pink, develops from the mesonephric duct, here in orange. The mesonephros, again here in red, would regress, but a portion will be incorporated in the future urinary bladder trigone. Also notice that the mesonephros here is just beside this blue structure. This blue structure is the future testicle, which would produce sperm, which needs to travel via these structures drawn in orange, which will later become the epididymis and the ductus deferens. This early, you can now imagine that when the testis will descend, when this one would descend and go to the scrotum, it already carries with it the structures which come from the mesonephric duct, again in orange. Okay, now let's go back to the yellow structure here. The common channel, which now is divided into the anterior and the posterior portion. Again, at this time point, the ureter here drawn in pink is now separate from its origin. This one in orange, the mesonephric duct. Notice that the septum here is now developed. This one is the urogenital sinus. This one is the anal canal. Let us now revisit this blue structure here. This is the genital ridge, which then becomes the testicle. The testicles will produce sperm, which then travels here through the orange structures, becoming the epididymis and the ductus deferens. Let's blow this picture up. You can now imagine that when the testis would then descend and go to the scrotum, okay, it will have a descent just like this. So just a recap. Yellow structure anterior. This one is the urogenital sinus. Posteriorly, anal canal. The urogenital sinus becomes the bladder, portions of the urethra. And this portion of the urogenital sinus, which becomes the bladder and the urethra, is called the vesico-urethral canal. From its name here, vesico-urethral canal, you can already guess that it becomes the vesico, pertaining to the bladder, and the urethral, pertaining to the urethra. Recall that in sagittal CT scans, there is this structure superior to the bladder, here, which early in life connects to the umbilicus. This is called the allantoid, which becomes the urachus. Now, remember the testicular descent? Let us now focus here on this green dot. This green dot would represent the point where the mesonephric duct, orange, drains into the early prostatic urethra. If we trace the course of these structures, okay, this orange structure here, we're going to get something like this. Okay, so focus here on the orange structures. The orange line represents the structures derived from the mesonephric duct. Here we have the ejaculatory duct, seminal vesicle, the ductus deferens or vas deferens here, and the epididymis. They are connected this way so that they can serve their function. In other words, they allow the sperm coming from the blue structure here, the testicle, go all the way up and then down because it's destined to come out via the penile urethra. So this is the explanation of the normal anatomy in the adult. So let's summarize. What becomes of the orange tick? This one, the mesonephric duct. Again, this one is the mesonephric duct, here in orange. So, the orange structure, the mesonephric duct, becomes the ejaculatory duct, seminal vesicle, vas deferens, and the epididymis. Next, what is the embryonic origin of the following structures? Urinary bladder, so we have here yellow, urinary bladder, which comes from the structure derived from the urogenital sinus called the vesico-urethral canal. How about the prostate gland? This one is the prostate gland, which develops by a bud coming from the urethra. Okay, so we're gonna call that the urethral bud. How about the urethra? Okay, the urethra here comes from the urogenital sinus. What about the ureter? Recall that the ureter comes from a bud here coming from the distal end of the mesonephric duct. This is called the ureteric bud. So now going back to this table coming from our reference, the bladder and proximal posterior urethra comes from this structure here in yellow. Okay, the urogenital sinus, which then develops a vesico-urethral canal. Next, what about the distal posterior urethra, membranous urethra, and anterior urethra? Comes from the urogenital sinus. The prostate comes from the buds here coming from the urethra. Recall this drawing, urethra forming buds, okay, and then becomes the prostate. What about the seminal vesicle? Buds coming from the mesonephric duct. Ejaculatory duct, vas deferens, and epididymis from this orange structure, the mesonephric duct. The testis, as well as the ovary, would come from this blue structure here called the genital ridge. I really hope that this was of some help. As always, I thank you for your time and support, and I hope to see you again next time on Part 3, the female genital tract.